Hey guys, welcome to Skinfiniti. Guess what? Today we've got this very beautiful, gorgeous nightingale here with us. Shalmali Kolgade, the Main Pareshan girl. Yay!
You dog!
Thank you so much for coming.
I am. Pleasure. We need you, you know that.
I'm so glad you came here. So, what are we going to discuss today?
Well, I have this thing that I really wanted to do for a long time. But I'm so scared if it's like the right thing to do, because to me, there's no looking back. Like once you do that thing, it's done.
What is it? What is it?
Tattoo.
Okay.
Do you have a tattoo?
I have two tattoos. I have one here, right here on my ankle. You see that? Yeah. And I have one on my back. Yeah. I mean, it's
When
a
did
cool
you get
thing
that
to
done?
do. This is about 10 years ago.
So is there like a right age? Is it like you're too young, or that you're maybe too old to do it, your skin can't take it, or?
No, there's nothing of that sort. I mean, you can tattoo at any age.
Okay.
If you see in our good old villages and all, you have ladies, they're tattooed right, when they're 2-3 years old.
Right.
Have you seen that? They have typically in Rajasthan, and they have all that. What is that? That's tattoo.
That is tattoo.
So there's actually no age for it.
Is there something like a test that you need to do before to see if your skin might, react a certain way?
Only if you have a keloidal tendency.
Okay.
Now, what is a keloidal tendency? People sometimes, whenever they get like a little boil or a scratch or even say a cut, that heals with a raised scar. Like, most of the time when people have burns on the chest, you see it's a raised scar. That's called the keloid.
Okay.
So, people with keloids should avoid tattoos.
Okay.
And if you're really very keen, then maybe you do a little test patch. And of course, you don't do tattoos when you're pregnant or you're feeding, just to be on the safer side.
Right.
Right? So, yeah, that's about it. And if you are diabetic, then you need some antibiotics to see that you don't develop any infections again.
Okay.
And that's about it.
So, are there any areas of the body that are more sensitive that you may not want to get a tattoo on? Like it's unsafe, or?
See, the first thing is the bony areas are very painful.
Okay.
So you've got to be careful, and if your pain threshold is very low, then don't go in for those areas. That's the only thing. That's the only thing. Another important thing which we, of course, most of us don't need, we must see if we have things like hepatitis, or, as medical professionals, we would always rule out HIV and, these kind of things. So, that's also important. I mean, anyway, you should get those tests done once in a year.
I think I'm feeling quite clear on this idea of getting a tattoo. I was very tentative for the one reason, okay, removing it. In case they make a mistake, they might be the best artists, but anyone makes mistakes.
Yeah.
Is there any going back?
Of course. You have the best of lasers now that are available. I mean, I have it at my clinic. It's a Q-switch Nd:YAG laser.
Okay.
And you can erase black tattoos, blue tattoos, grey tattoos completely.
Okay.
The green ones also. But the only thing is that it's not as easy as going there and getting it done and,
it's gone.
It's gone. No.
Okay.
It takes about a year, because you've got to do a session every 6 weeks.
Okay.
And you'll need about 6 to 8 sessions. So it's like a long procedure.
So it fades away then?
It fades off. So every time the laser is shot onto the tattoo, the tattoo pigment breaks.
Okay.
And then part of it is sort of excreted, and some of it remains. Then again you shoot on the remaining. So it depends. But if you go, the sooner you go, the sooner you can remove the pigment, because it hasn't really gone into the deeper layers of your skin.
So it's harder to remove a very old tattoo.
A very old tattoo will take longer.
It will take longer.
It will take longer. Another thing is the area. I feel, do it in an area where you can't see it every day.
Yeah.
So you don't get bored of it, because you can't see it.
Yeah, which is why I was thinking on my back.
That's fantastic. Like,
That's
I have
nice,
one here, so I don't have to bother, 1 year. Like,
I think it's just supremely insane that a doctor has a tattoo. I mean, you should flaunt it.
Thank you.
Post-care. Is there anything like a post-care of a tattoo?
Oh yeah, yes. See, what happens is, obviously there's like, too many needles going into the skin. So you will have some inflammation, some swelling, some redness, some pain, okay? So you should apply an antibacterial cream, like a T-Bact. Usually tattoo artists are very fond of giving calendula cream,
okay,
which is a homeopathic cream. But we prefer to give something like a tea-backed or a Fusi-bet cream, which helps in healing that wound faster. And you know, you don't develop infections. So that's very important. And don't do it on areas where you have an infection. Like if you have an ingrowth, or if you have boils, or if you have, say, pimples, then don't do it in those areas. That's very important.
Okay.
Yeah.
I think I'm going to go out from here, and I think I'm ready, Doc.
Super! So next time we see you here, you're going to show us your tattoo.
Yes!
So Shalmali, we are going to end here, but I'm not going to let you go without a song.
Oh my God, yes. So definitely, I was a little pareshan about getting this tattoo.
Okay, I thought you were pareshan about coming here.
Of course not. I'm never pareshan. I have to, whenever I have to get rid of my pareshanis, I come to Doc. Anything that's skin related, this is where I go.
Thank you.
And I'm so relieved that there's a person like you in our lives. So I don't have to sing this song as much, but right now I should sing it because, well, like I started my career with it, right?
Yeah, of course.
नए नए नैना मेरे ढूंढे हैं दर बदर क्यों तुझे नए नए मंजर ये तकते हैं इस कदर क्यों मुझे जरा जरा फूलों पे झड़ने लगा दिल मेरा जरा जरा कांटों से लगने लगा दिल मेरा मैं परेशान 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 आतिशे वो कहाँ मैं परेशान 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 रंजिशें हैं धुआं
Fabulous. Fantastic. You're so awesome. Thank you. Okay, folks, just for you to know, she's got another channel of her own. It's called Shalmali's Den.
Yes!
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 So you can check out all her songs there and all the different
songs
things.
And a whole lot of other madness that's part of my life.
Yeah. So you can subscribe to that. And
perhaps they'll get to also see maybe the tattoo in the sequel of this episode on my channel.
Oh yeah, fantastic. So subscribe to Shalmali's Den and subscribe to Skinfiniti. Post your comments here and tweet to me. My handle is @Jaishree Sharad. Bye.